Greetings to brothers and sisters who happen to, to get this video. It's once again your brother Abubakar Zakaria, your first aid nurse, bringing to you another episode of First Aid. As I have always advised, it's very important, in fact, very important that everybody gets some basic first aid, measures on your fingertips. So for the sake of your family and for the sake of people you meet outside who needs your help, we all have to I mean, uh, have these basic first aid measures on our fingertips. And then today we are going to discuss what we call CPR. As I did promise in my last video, we are going to discuss what is CPR. CPR is cardiopulmonary resuscitation. And then according to the American Heart Association, they describe CPR as an emergency life-saving procedure performed when the heart stops beating. They say immediately CPR can double or triple chances of survival after cardiac arrest. So what are the indications of CPR? What will tell you that this person who is lying down, he needs CPR to be done to help save his life, double his chances of survival. Assuming you are in the house and somebody suddenly collapses, or you just come to the house and you see your son lying down, or you are walking on the street and you see somebody who has just fallen or he's already down, what are the indications that you have to enter and start doing what we call the CPR? The first thing is that the person, it becomes unresponsive. Unresponsive means that you call the person and he doesn't respond. You pinch him and he doesn't, react to anything, to the pain. He doesn't, respond to your call, or he doesn't react to the pain. So when you see somebody lying down like this, the first thing you do is to hold his shoulder and then shake him and then ask him a question loudly. You shake the shoulders and then ask him loudly, "Are you okay?" If he doesn't respond or he doesn't move anything, his hands to show anything, is an indication that the person has become unresponsive, and immediately you have to step in and then start CPR. If the person is not breathing, or you just saw the person and he's not breathing, it's an indication that the fellow needs CPR to be done for the person. Or if you can check the pulse of the person and is very weak, it's also another important indication. If the person he's breathing, but it is an abnormal breathing, which we call apnea or agonal respiration, or what we call gasping respiration, it's also an indication that you have to move in and then do CPR. The agonal or gasping respiration is when the person breathes in, he takes in a breath, and then it takes time to release it or breathe out, and then it takes time to take another breath. He is breathing, but it is not a normal breathing. You have to start the CPR. So CPR, as we will be discussing, has two aspects. There are two aspects of CPR. Number one is what we call the chest compression or hands-only CPR. That's number one. And then number two is the rescue breath or the mouth-to-mouth respiration. But for health professionals and those who are trained to do CPR, who are have been taken through first aid, they are not health professionals, but they've been trained to perform this CPR. They combine the chest compression or the hands only CPR with the mouth-to-mouth respiration. But for the general public and those who are not trained, you are to do chest compression or hands only CPR, or chest compressions only CPR. So take note, these two aspects, if you are not trained, you don't do the mouth to mouth. What you do is the chest compression only. And the mouth to mouth is also very simple. When you have a professional take you through before you can do it, it's also very simple. You are simply helping the person breathe by breathing into the mouth of the person. You put your mouth to cover the person's mouth and then breathe into the person. If it's a child to or an infant, if it's an infant, you use your mouth to cover both the mouth and the nostrils. But as I said, we are not going to discuss that. According to the American Heart Association, they recommend that you do only hands, you do the hands only CPR, and it's enough to help save the person till you get help. So we are now going to move, to describe what the CPR is. If you come across somebody who is just, who has collapsed, so there are two things. In case you were with the person when he collapsed, you saw him collapse, the first thing you have to do is to pick your phone and then call the ambulance. It depends on the depending on the country you are, you call on the ambulance. But as I have always said, in Ghana, we actually don't have so many ambulances, so it becomes difficult when in the house. Sometimes it's easy when it's an accident, major accident, and you call, you might have them come. But if it's in the house, in fact, it doesn't happen when you call ambulance and they come to the house and pick your person. So as I've always said, you arrange for a taxi. Arrange for a taxi. So the first thing you do, if you were there when the person collapsed, if it's a child and you were there when he collapsed, immediately call the ambulance. And he has all these signs calling for CPR. The first thing you do is to call for help. If there's somebody around, you call the person, and that person will call the ambulance while you enter into doing the CPR. But if you find yourself alone with that person, then you will have to call for help first. If it's a taxi, you will have to, if it's the ambulance, in fact, it becomes difficult to describe how to do this in, where we have difficulties with ambulances. But the only option for you now is to get a taxi. But if it's a child you have just met, and he has collapsed, you use 2 minutes to do the chest compressions before you call for help. Remember, if the child collapsed right before you, you call the ambulance first before you enter into the compression. That is if you are alone. If you are two, obviously one has to be to do the calling while you enter to do the CPR. I just want you to understand the basics around it. But if the person drowned, if it's a case of drowning, you have to do the CPR for 2 minutes before you call for help. If he drowned, you have to call for help. Number one, if he drowned or he's a child, you have to do the CPR for 2 minutes before you call for help. So as I said, we are not going to have the demonstration with our brother. He has all the signs of somebody who needs CPR, and he's an adult. He's an adult, so we first demonstrate. Remember, we have CPR for children. We have CPR. We have CPR for adults. We have CPR for children. We have CPR for infants. So we are going to start with the CPR for adults. So you stand by the side of the person. This way, you stand by his side. You squat by his side. And where to position your hand is very important. These are the nipples of the victim. You create an imaginary line between with the nipple and put it right in the middle. You put the heels of your hand right in the middle. You put the most dominant hand on top. And make sure you straighten your hand. Don't let your hand be like this. Straighten your hands, because you are going to apply pressure, and with the pressure you will need your whole body. You will need your whole body to help you push in the heart, the chest. Remember that. So you put the heels of your hand right at the position I said, the nipples in the middle. You put it there, the heels, and then you put the most dominant hand on top. As I said, you straighten your hand because you are going to use your whole body to get enough compression. So you go this way and you push in very deep, hard and fast. Hard and fast. The depth you are supposed to go in, how deep you are supposed to go in, it says that you go in between 2 to 2.4 inches or 5 to 6 cm. That's how deep you should push in the heart, and you should achieve between 100 to 120 compressions within a minute. That means you really have to push in hard and fast. So with your hand there, if you are a lefty, somebody who can use your hand, your left hand much, so you interlock your fingers this way, right at that position, then you push in. Fast, push in fast and deep. I don't want to hurt my brother because he doesn't need it. So you push in fast and deep. While you do that, you keep monitoring whether the person starts breathing or not. If he starts breathing, you stop it. If he starts to breathe, you stop it and put him at a recovery position. We will come to that. Let's finish with that of children before. So if it's a child here, I mean, by a child here, I mean a child, somebody between a year and 8 years, between 8 and then 8 years, or somebody he has a very, a small body. You use only one hand at the same position. You straighten your hand and then you push in. You push in. The same number between 100 and 120 per minute, and the same depth you go between 2.4 to 2 to 2.4 cm, or 2 to 2.4 inches, or 5 to 6 inches cm. So that's is the same thing, but only that if it's a child you use one hand. But if it's an infant, that's a baby between age 0 and 1 year. You use these 2 fingers, not the whole hand, not 2 hands, but these 2 fingers. And you, the same between the nipples, you create an imaginary line just below it, and put the 2 fingers there, and you are going to do the same compression, but this time this way. You are going to use this way, but you don't go as deep as in adults. You don't go as deep as in adults. With these infants, you go 1.5 inches deep, or 4 cm deep. That's how deep you go. So after you have, while you do this, you have already called in for help, and when the help comes, you send they will come and then continue. The professionals will come and then continue. Or while the taxi, you are waiting for the taxi, it comes, you convey the person to the hospital. As I said, if you do it and the person begin to breathe, you put him at what we call the recovery position. The recovery position is this way. As he lies, if he begins to breathe, you just squat by this way and hold him and draw him before you, and send this, bring this one here, this way, and then you put this hand here. Look at it very well. You put the hand this way to open up the airway, to ensure that the person gets to, breathe in more. So you allow the person this way. You allow him this way till help comes. Remember, you allow him this way till help comes. Moreover, if you are with somebody, sometimes in a crowd or in the house, due to stress, or the person's sugar level runs down and he is fainting. If he is fainting, you quickly hold the person and don't allow him fall. Don't allow him fall. You quickly, hold him and then gently put him on the, on the floor. And remember, the CPR, you do it on a hard surface. Don't put the person on the, if he's in the house, don't put him on the bed and start doing this. No, you put him on the floor, on a flat surface and a very hard surface, so that you can achieve, a high level compression. So if the person has just fainted, so if the person has just fainted, you put him on his back at this position. You put him on his back like this, but fainting means he's still breathing, but he's gradually running down. He just fainted. You call him, he can respond by his dial, and maybe he just fainted. So you hold the feet this way and raise the feet. You can find something and put the feet on it and raise the feet this way while you monitor for his recovery. But if after a minute he doesn't recover, or he's twitching, or if the person who just fainted is a pregnant woman, immediately call for help. Immediately call for help. That is all about CPR. It's very simple. We all can do it, and it's a serious life-saving procedure which we all, should have on our fingertips. As the American Heart Association will say, that it's far better to do something than to do nothing at all. That if you are fearful that your knowledge or abilities aren't 100% complete, remember the difference between your doing something and doing nothing could be someone's life. And it doesn't matter whether the fellow is a male or a female, you have to go in and then do the CPR, because research has shown that males actually receive bystander CPR more than females. So we should all, irrespective of the sex, the fellows still need your help. So once again, it's your brother Abubakar Zakaria, a nurse from War Memorial Hospital. This is where we end it. My contact is 0249 60 1882. You can also get me on my Facebook page, Your First Aid Nurse. One word, Your First Aid Nurse. You like the page and then share this video. Thank you very much. Bye.